you. Dr. Fatema Tuz Zohra is we are the batchmate, and we studied together in CBMCB Bangladesh. And she has completed her AMC Part 1, and she is currently doing residency in psychiatry. So today she will be guiding us through all the process, all the things, all the doubts that we have. We have collected a few questions regarding the AMC that we have submitted in our groups and the Facebook page as well. So we'll be going all through the questions, and also we will be taking questions from the live as well. So till then, after that, then we will begin the question and answer session. If anything is there, if Dr. Niti wants to add anything, then she can proceed.
Good afternoon, everyone, and hi, Dr. Fatima. We're so glad to have you share your experiences with us. Actually, we've started this platform because we very few information regarding AMC among Nepalese community, Nepalese doctor community. So we started this so we know what are the pathways there are, and so that we could help each other out. And we're so happy to have you, a doctor from Bangladesh, doing her residency in Australia, helping us here. Thank you so much, doctor, and welcome to this session.
Oh, it's my absolute pleasure. I hope it will be helpful for you guys. It's a hard journey, so happy to help anytime.
Thank you, doctor.
Is everyone joined so far? So probably we'll proceed further.
Yeah, we can see a few people still continue to join. So I think we can proceed.
Sure. So who already passed the AMC1, probably you know the starting point. You have to do the verification of your qualification and then book for the exam, doing your exam. I'm not sure if Nepal has the exam venue. Does Nepal has the exam venue?
No, doctor, we don't have exam venue.
Yeah. So there are some countries who has the exam venues in Asia, but unfortunately Nepal, Bangladesh doesn't have. But our neighbor country, India, Pakistan, I think Thailand, Singapore has the exam venues. Okay. So I will start with the MC1. Who already passed the MC1? Congratulations on your achievement. It was a big step. Because until you achieve the MC1, you are kind of stuck to get into the Australian setting. But if you have already passed the exam, it opened a door for you to get into the Australian healthcare system. So AMC has two parts, AMC1 and AMC2. The clinical exam, or someone prefer to do the W-based assessment. The W-based assessment is a short form of workplace-based assessment. So after passing the AMC1, is actually very much possible to get the job in Australian hospital. I will reflect more on this procedure, how to get the job after AMC1. So if you have any specific question, just ask me. Otherwise, I will go step by step.
Doctor, I think we'll first like to hear from your end, and then later we'll get in some questions.
Okay, yeah. So, and I'm assuming everyone is in Nepal. Anyone from Australia, like living currently in Australia?
Yeah, I am here in Australia, and few doctors are here in Australia. Some are from living in India and different other parts.
Okay, all right. So the doctors who are living in outside the Australia, after passing the AMC exam, there are a few things you can do. One, you can start your preparation for AMC Part 2. You can book your exam online. After COVID, they have started a new style of exam. online exam. So you can book your exam for online examination, and you can sit for the exam from anywhere in the world. For face-to-face AMC exam, you have to come to Australia. There is only one venue for AMC Part 2 in Melbourne. No other part in Australia. It's just in the Melbourne. So you have to come to Australia and you have to sit for the exam. So for coming to Australia, people usually, before the COVID, when there was no online exams, people usually did get the visa for tourist visa. They come to Australia and sit for the exam. You can book the exam for online, but there is some saying that they will stop the online option after this year. So from 2025, they will again start the exam only face-to-face. So there won't be any online option. But it's not yet announced from AMC. So I think for a huge number of students are attending this exam from the outside of Australia. So I'm not sure how they will manage this crowd, but it was a good attempt to make it online. It was convenient for them and convenient for the students as well, for the doctors as well. Just keep in mind that it can be face-to-face, no online option from next year. So preparing for part 2, I will highly recommend to prepare your online or whatever face-to-face AMC clinical exam while you're doing a job. Because they like to ask two things when someone is applying for the job, any role: recency of practice and English proficiency test after part 1. So recency of practice means in last 12 months, have you clinically practiced or not? It can be in GP setting, it can be in hospital setting as well. But recency of practice, I would say the second most, after AMC part 1 and English test, the second most important thing for getting a job. And they take it very seriously. The hospitals as well as AFRA for giving the registration, they take it very seriously. So it's really important to keep your recency of practice active, like working in last 12 months. Sometimes they ask for 24 months experience, like 2 years experience, including recency of practice. Sometimes, if some people have the recency of practice, they will overlook that 24 months of experience requirement. But recency of practice is really important. So I would highly recommend to keep your recency of practice active. Work if you think like you want to actively prepare for AMC clinical exam. You can work part-time. You can work telehealth. You can show telehealth in your CV. Though during my AFRA registration, they told me that they will not count telehealth as a recency of practice because that was post-COVID period. But during the COVID period, they were taking the telehealth as a recency of practice. So it's really important to keep working. That's my first recommendation to everyone who is currently out of Australia. So you can prepare for AMC Part 2. Still, you can keep applying for jobs. So there are few, we are all through the standard pathway. There are few registration types in standard pathway. So one is limited registration. Limited registration means you can't get into a formal training program while you are on limited registration. You have to have the general registration, and you have to work under the supervision. So wherever you are working in hospital or GP, you have to work under supervision. That's limited registration. So after getting your AMC 1 exam pass, if you apply for a job, and if you get the job, you will be applying for APRA registration. So it's not like after AMC 1, you will get the registration, then you will job. It's the other way around. So after AMC 1, you have to apply for the job. You have to attend the interview, reference check, and all this. After all these formalities, if a hospital offers you a job, a position, only then you can apply for your registration. So with AMC 1, if you are offered with a position by a hospital, you can apply to AFRA for your limited registration. So limited registration, they initially gives for 1 year. After 1 year, you can renew your limited registration for 3 times. Okay. If you pass your AMC Part 2, AMC Part 1 and AMC Part 2, you will be on provisional registration. After working 1 year in provisional registration in hospital, you can apply for general registration. It's really important to get the general registration as early as possible. Everyone's aim, whoever is working in Australia, everyone's aim is primarily to get the general registration as soon as possible. Because there are some roles we call locum. Locum roles means some hospitals, when they are short of short of doctors or nurses, like if someone is getting for sick leave, study leave for a long period of time or short period of time, they will advertise for locum position. So you will not be a permanent employee of that hospital, but you can only work for 7 days or 14 days. The good thing about locum thing is it's highly paid role. So without that general registration, you can't work on a locum position as well. And if you want to get into a formal training pathway for medicine, surgery, psychiatry, whatever the department is, you have to have the general registration. There is another option for which called WBA. So AMC part, when someone passed the AMC part 1, the WBA can be the next step, because you have to get a job from a hospital that link to the WBA. So first you have to have the job from the hospital, then you have to apply for the WBA to this hospital. Someone asked me the pros and cons of WBA. I will answer that, but just to let you know that for getting the WBA position, you have to first secure a position to a specific hospitals, which are linked to the WBA program. So not all the hospitals in Australia are linked to the WBA program. There are some specific hospitals. I can send the link, or you can just Google it, the WBA hospitals in Australia. So those specific hospitals provide the WBA program. And when you already got the job from the WBA hospital, then you can apply for the WBA. From the outside or from not getting the job, you can't go to the WBA program. For AMC2, there are few things to consider, I would say. Like, it's definitely depends on the personal preferences. Like, after AMC1, do you want to work first in hospital system, Australian hospital system, or do you want to study, do the AMC2, and then you want to start working? So it's up to your personal preferences, your living situation, your family situation, your commitments. But if someone asks me my honest opinion, I would say someone who is living outside the Australia, keep working, keep preparing for AMC2, because you have to eventually do your AMC2 for getting your general registration. Without WB or AMC2, you won't be able to get your general registration. And limited registration is not a indefinite thing. It's just 3 years registration, and you have 3 opportunities to reapply for the limited registration. Um, so after the 3 year, when you have already renewed your limited registration for consecutive 3 years, you have to apply from the beginning for your another registration. So it's absolutely depend on APTA. They will give you a registration or not. And AFRA is very much like very complicated thing to handle. Not a pleasant experience for most of the people to go through the AFRA things again and again. So I will, from my suggestion, from my perspective, my suggestion would be keep applying for the jobs from your home country while you are working, and try to prepare for AMC2. Is there any questions so far? I need to clarify anything? What I have
Doctor,
mentioned?
most of the people are like asking, like, after completion of the AMC Part 1, like, until when we should complete AMC Part 2? Is there any time frame or such thing
No.
regarding that?
So there is no time frame at all. Probably if you pass AMC Part 1, the Australian Council, Medical Council, AMC, will send you the email. They don't advertise on the board or their website. They will send you an email to your personal email address that the AMC Part 2 dates are open. What they did this time, they keep changing their system. So it's very unpredictable, like when they will what. But this time what they did, they send the email to everyone that the dates are open for probably 3 or 4 months. The dates are open. They ask the candidate to give 3 preferences of dates. Like, you will send them 3 dates, your preferred dates, and they will confirm you with 1 date, like which will be your exam date. There is no time frame. You can, like, this different thing, you can keep doing your job. You can wait 2 years, 3 years time. You can, if you are already booked for the exam and you recently joined the job, within 7 days, within even joining the job, like, for example, if you join the job previous day, your exam is next day, that can be happened as well. So there is no definitive time frame.
Okay, doctor. So, like, so how repeatedly can we give like AMC Part 2 exam? Like,
So
how repeatedly can we give the Part 2 exam? Like, if someone just failed or something, then can
as
he
much as
repeatedly
possible.
as much as possible in that
Yeah,
case too?
yeah, yeah, yeah. So there is no limitations on that. So you can appear to the exam as much as you want.
Dr. Ashok has raised his hand.
Yes, Dr. Asok, if there is any query, you can ask.
Hello, Doctor. Good afternoon.
It's a good night to me, good evening to
Oh,
me, but yeah, good
okay.
afternoon.
Good afternoon. My question is that if I take book a exam date for November, then it is the last date for this year, huh? So I can postpone it for next year or not.
Depends on AMC. So there's a certain interval, like before that, you have to inform the AMC and you have to have a specific reason um, for postponing your exam. Refund, yeah, depends on your what's the reason you're trying to postponing or canceling, but you can postpone to the next year.
Yeah. Yes, yes.
But
Uh, uh,
again, someone asked me like, can we book exam any month of a year? Unfortunately, you can select 3 dates of 3 months, but it's up to the AMC what date they will give you. They will confirm you. So you can select 3 dates. It can be same month, it can be different months, but it depends on AMC which date they are confirming for you. So it's kind of 50-50, not quite flexible, but on your preference date. Yeah.
Doctor, I have a questions regarding recency of practice. Is it like you'll have to have at least 12 months of recent practice?
Sorry again.
So do we need to have at least 12 months of recent practice, or within 12 months, if you practice for 6-7 months, that is also good enough?
No, that's also good enough. So in recency of practice, I know people, uh, they were living in Australia for a long period of time, probably more than 3 years, and they couldn't go back to their country. And everyone was asking for recency of practice. So the hospital prefers recency of practice, like working within 12 months for at least 3 months. That's after requirement. But I saw people, they got the call from hospital after working just 1 month. So, but if you talk about the after requirement, the recency of practice means within last 12 months, have you worked for 3 months or not?
Thank you, doctor.
hello. Sorry for interruption. My next question is uh, for experience. Is it uh, if we work in polyclinic or not a big hospital, tertiary level hospital, it is valid or not? I mean, it has any impact on our CV? Like we are working on some polyclinic, some small like private hospitals, but not big tertiary level hospitals. What about that?
No. Like in general, no. So, but you have to portray your hospital in such way that you are getting a like patient every day. You are seeing this much patient, and um, you are seeing different cases as well. So if it's not a tertiary hospital, it's a, I'm not sure what's the clinical setting in Nepal, but in Bangladesh, like in villages, in small towns, there are many private hospitals, there are many clinics, small clinics. It's still valid uh, as long as you are working. Just try to highlight what are the positive things of your role and of that hospital or clinic. Like if it's in a village or in a small town, you don't need to mention that it's situated in a small town. You can portray it in such way that it's a hospital. That hospital, we are getting different kind of patients. You can mention what kind of patient you are getting: cardiac, obs and gynae, surgical patient, medicine patient, nephro patient. And show your focus on your delivery, like how many patients you are getting, that how many kinds of patient you are getting. So it doesn't matter as long as you are working somewhere.
Thank you, doctor. There are a few more questions like, does CPD points for the IMG matters, or can we do the CPD before giving clinical examination too? Like, how does it help, or
Hmm.
so on?
So the CBD point, CBD means continuing development. CBD,
Yeah, continuous professional
continuous
development. Yeah,
professional development. CPD.
CPD.
Yeah. So CPD points mainly required for the AFRA registrations to keep AFRA registration active. One thing. So for the GPs, it's really important to keep their CPD point. Like there's some required points that everyone needs to get within 1 year. This is one thing. The other thing is, if anyone has clinical gap, like more than 3 years, they haven't worked in any clinical setting in Australia or outside Australia, there are some requirements from AFRA that they have to have 150 points in 3 years or 1 year. 150 points they have to have before applying for the registration. But for the doctors who is currently working, they don't need the CPD points to be counted. They don't need to count their CPD points. But what you can show that you are professionally committed, um, like you are committed to your professional development, and you can show that you have done workshops, courses for your learning from your like for your enhance your clinical knowledge, for instance, enhance your governance knowledge as well. So I'm coming uh, to that point, like what can make you a higher chance for getting a job from the outside. That's one of the things that professional development courses. But for the IMGs, doesn't need to count the CBD points if they don't have the clinical gaps. Does it make sense?
Yeah, that makes sense, because we have a lot of doctors who is not practicing at the moment and who are practicing at the moment. So for the practicing like doctors, if they can show their practice and they can
Yeah.
secure the job, and it
Yeah.
will help them as well with the continued practice.
Yeah.
But like for the non-practicing doctors, so the CPD point will be more effective while applying for the job in Australia. Like as you have said that 150 points for the non-practicing doctors will be good enough for the
So
non-practicing doctor.
it's a minimum thing, and
Uh-huh.
I really need to highlight one thing, that when you are applying for a job to hospital doesn't care you have CBD points or not that much. What hospital does care? You have reasons of practice or not. Honestly, that's a very, very straightforward answer. But AFRA will ask for your CBD points if you have the clinical gaps.
Okay, doctor. Maybe we have Dr. Dr. Astrita wants to ask something, so you can proceed.
Sure.
Doctor, I want to ask you about the observership programs. If we do observership in Australia, are there any higher chances of getting job, or can you please focus on this topic?
Sure. Just to let you know, I did a observership in one of the hospitals in Melbourne, Northern Health. So whoever living in Australia, like currently in Australia, I will highly, highly, highly recommend to do a observership. There are a few things regarding the observership. One is there are some programs. Okay, I think someone's mic is on. That's all right. So few things regarding the observership. Few hospitals has specific program for IMGs, like Monash, like Northern Health. I forgot another hospital's name. So what they do, they call it transition to practice, but these positions are paid. So the candidates will apply for those positions. It's kind of observership. They will take an interview, and if you pass the interview, you have to pay a certain amount. Like Northern Health, I had to pay for my observership, 6 weeks observership. It's not observership, transition to practice program. I had to pay $2,500. And Monash has a very expensive ones. I think that's around $4,000 or $5,000 just for the observership. So you will get into that program, but Monash will give you the registration for 1 year. But they will not pay you, I think, for that 3 months or 6 weeks. So I'll try to make it more concise. If someone is interested to do a observership, there are few hospitals, they offer the observership. Some of them are paid position. So if you got selected for the observership, you have to pay to the hospital. Some of them are free. Like where I did my observership, it was a paid. I had to pay for 6 weeks program. But for my current hospital where I'm working, they offer observerships, but they're kind of free. So you can also talk to the consultants, some of the hospital consultants, if you can make a contract with them and ask their permission for doing a observership. This kind of thing, this kind of setting, like when you are requesting something, requesting a hospital or requesting a consultant to do the to observe the clinical setting, it's sometimes free, but it was in high demand. So hospitals made it a paid thing. So you have to pay now for doing the observation. And your question was, is it high chance or not? It's Northern Health. As far as I know, every year there are 12 people are getting in the program for in 2 settings or 3 settings. Everyone got the job, HMO job. So if you can make a good impact, like if you can show the consultants, your colleagues, your observership supervisor that you are hardworking, you have the clinical knowledge of a comparison to their HMOs, you have that clinical knowledge and you are hardworking, you are dedicated, there are high chance to get the job. Definitely, it will increase your chance to get the job. And honestly, the hospitals who offer the observerships prefers to get the HMOs from their observerships, because when you are doing the observership, you already know the hospital, you already know their system. So it's kind of, it will get you, when 6 people are applying for a HMO position, definitely you will be preferred to get the job.
Okay, so the observership is also the good point, like if you are applying in the same hospital too.
Yeah, even not for the same hospital, in any other hospitals as well. If you have an observership experience, definitely you will get some preferences. But for
So,
get into the observership, you have to have the visa, like you have to be living in Australia.
so it will also add on to the clinical gap as well.
No,
No.
unfortunately, no. Observership will not count as a recency of practice.
Doctor, can we do
Okay.
observership while on tourist visa?
Uh, you can talk to the hospital. It's a very complicated thing because you are just observing. You are not earning money. You are not working. You are not doing anything. You are kind of observing. So you can talk to the hospital in that regards. But when in more practical setting, when they do the short list, they actually almost always prefers the candidates who are currently living in Australia. Like if there are 20 candidates and 6 positions of observership, and probably 5 people are from outside Australia and 15 people is from inside Australia, they will definitely shortlist all the people who is currently living in Australia. It's very unlikely that you can get a call for observership interview while you are outside Australia. There are some visa requirements, so it's very unlikely that you can do it outside from Australia. You can apply for the outside Australia.
Hello, doctor.
Hello.
So what's the requirement for observership, doc? Can we apply after MC1, or do you have to get a general registration and then observership?
So observership, there are few requirements. Where I did the observership, the requirements was passing MC1 or MC2.
Okay.
You have to be in Australia with a valid visa,
Mm-hmm.
and you are not currently working or didn't work. Like you don't have any after registration. So these are the requirements for observership.
So after MC1 result, we can apply for observership.
You can apply for observerships. There are some other requirements like visa condition, English proficiency test sometimes. So MC1 English proficiency test, living in Australia with current visa. And you are not working as a doctor in Australia and you don't have registration.
Okay.
After registration.
Doctor, most of the questions they were interested in your journey as well, like your position being as a registrar psychiatry after AMC Part 1 in the Mildura Base Public Hospital. So, like,
So
what made you? Yeah.
Before jumping, then there was another question. Wanted to ask: once we pass AMC exam and get job, when will one be able to bring? So when you will get the job and you will apply visa, you can apply visa for your spouse at the same time. So you don't need to wait for anything. Like you can apply spouse visa for your spouse with you, and you can bring them with you as well. Maddie, is it Maddie girl? Ask me the question. Sorry, I was late to answer. I'm not sure you are still here or not. Yeah, okay, I can see you are here. I hope that helped. So you can bring your spouse or with you anytime. Okay, so my journey. I finished my MBBS from Community-Based Medical College with Projal. Projal was one of the smartest boy of our batch. So after finishing my MBBS, I didn't wait much in Bangladesh. I came to Australia for doing public health, Masters of Public Health. So I did my Masters of Public Health in Macquarie University. After finishing of Masters of Public Health, so before coming to Australia, I thought I will be going to research line, or I'll do another PhD, or I'll be in public health sector. But while I was doing my Masters of Public Health, I found like I was missing my clinical side. Like I found I was better in non-research thing. You know? So I decided to do my AMC exam, license exam. After finishing my Masters of Public Health, I started my preparation for AMC Part 1. While I was preparing for my AMC, it was very uncertain journey. So I did another certificate 4 in specimen collection. It's called pathology, certificate 4 in pathology. So I did that just to get a job in healthcare sector, like in pathology, specimen collection, this kind of job. I was determined that whatever I will be doing, I will try to get a job in healthcare sector, because it will probably not give me the residency of practice, but it will show that I was connected with the healthcare system, you know, or I have the basic knowledge of healthcare system. So I did my certificate 3 in pathology. Then I passed my AMC 1. I got married. So that there was a time being that I was away from everything. After that, I got a job as a surgical scientist. Surgical scientist means I started working in a very renowned pathology, Sonic Healthcare. That's the biggest pathology in Australia, as a surgical scientist. So then I moved to Melbourne. I started working as a psychiatric service officer in hospital, in Sunshine Hospital, Melbourne. So it was in psychiatric department, but not as a doctor. It was an allied health role. So it's kind of social work and occupational therapy. I was under the umbrella of occupational therapy and social work kind of job. So I did that for 1 year. Then I applied for this job. I was applying, believe it or not, I was applying hundreds of jobs. So I applied for at least 250 jobs after passing AMC 1. And I got, I think most of them were rejected, but I got interview calls for 7 or 8 positions. Was offered 3 jobs. So 250 to 300 job application, shortlisted for 7 or 8 jobs. I did interview for 7 or 8 jobs and was offered 3 jobs for this long time. And I did the observership as well. while I was doing working as a psychiatric service officer, I did my observership parallelly. So I took off from my work and then I did 6 weeks observership. Then I got an interview call from this role, for this role. My interview was probably really good. There were other candidates who were already working in different hospitals as a psychiatry HMO, but they selected me, luckily. So the next step was AFRA. AFRA is a big thing to pass. Sometimes people probably like get the job of pass AMC1, but AFRA rejects the registration. So AFRA took 7 months to give me the registration. And they asked me several questions. They asked my employer several questions, several times. And we had to clarify those questions. And then after 7 months, AFRA gave me the registration. I'm working for 1 year now, last 1 year. Why 7 months? I don't know. It was up to AFRA. So is that for, no, it's not for everyone. I know people who got the registration within 1 month. It's case by case. Yeah. It's so it totally depends on individual cases. Sometimes they take really like long time. Sometimes they just give the registration pretty soon. So for me, it was 7 months. I'm working there for last 1 year. That's my journey.
Thank you, Doctor, for telling your wonderful journey to us.
No.
So,
Yeah.
so you after completing your registry as a registrar, like you do need to give the like part 2 examination, or like you get directly registered, or
Yeah. So the position I'm working now, it's called unaccredited registrar. Unaccredited registrar means for my psychiatry specialty, for being a specialist, I have to do the fellowship program, which is for 5 years. That's called, when someone is in that formal training program, it's called accredited position. So I'm currently in unaccredited position. So I have to have my general registration to be on that accredited position. And as I'm working now, this time will be evaluated by the training authority. And if they want, they can recognize this period as a prior learning and can reduce my total training time. So if I'm working for 1 year now, if it get the, they recognize it as a prior learning, they can make my training for 4 years instead of 5 years. So the hospital I'm working, it's a workplace-based assessment hospital. I thought it would be quite a straightforward journey. I'll be in the workplace-based assessment training because I have a very little kid, 17 months old. So I prefer to get into the WBA program rather than taking intense preparation for part 2, because I have to have some time for my kids as well. But after getting here, I came to know even for WBA program, I have to wait 1 year to apply, to be eligible for apply. So for be eligible for applying, someone needs to work here for at least 1 year. And then they will shortlist the candidates. they will do another OSCE exam for final selection. So I wasn't eligible for applying WBA last year. I applied this year, and I have to sit for another OSCE exam for final selection. I found this is very time consuming. So I now I'm thinking to do my part 2 exam next year.
Okay, doc.
Thank
So, yeah. So Dr.
thank you,
Niti will
Doctor.
be like leading the now.
Okay. Thank you, Dr. Prajul. Doctor, we have a question. I think you can see it, no, Doctor,
Okay.
from Dr.
Yeah.
Satika.
Before Satika, Ariyattara, do you feel your MPH was helpful? No, not at all. My MPH wasn't helpful, and that was not my plan as well. Like, you know, doing MPH, then getting into the Australian healthcare system as a doctor. So my plan was I will be doing researching or PhD. That's why I chose MPH that time. But when I changed my mind to do the AMC, I found it was not helpful at all. If someone wants to go for the AMC pathway, like wants to be a doctor in Australia, MPH can be waste of time, waste of money, and waste of energy. Yeah, that's my experience, sort of. It's only can get you visa to come here. Otherwise, it's not helpful at all for your journey, for your AMC journey. And what it actually did with me, my MPH, because I came here for doing the MPH, there was recency of practice. So I would recommend someone who wants to do the AMC to stay in their home country, keep working while while they will be preparing for MC1 or MC2. It's highly recommended. Like my sister-in-law, she's currently working in Bangladesh, and I suggested the same. Like she wanted to come to Australia for doing masters and then do the AMC, and I was quite like, no, keep doing, keep working, keep your recency or practice active, and now she already finished the MC1. She's applying. She has been preparing for MC2. So that what I have suggested my family member, I will suggest everyone. Like, if you are determined that you will do MC1 and you will come to Australia for doing a job as a doctor, don't waste your time to anything else. Just focus on AMC and prepare yourself for that long journey. Okay. I came in late, so basically you did not do MC2 before. No, I haven't done the MC2. I even haven't sit for MC2 at all. So I did my MC1. I did the English test. I did heaps of CPD courses because I was living in Australia. I did probably a lot actually. It's quite unbelievable number of CPD courses. So after I usually ask for 150 hours, but I did probably 370 or 380 hours CBD courses. So, and I did BLS, ALS courses, many clinical workshops. So yeah, because I had, you know, that time I was pregnant. After that, my child was very little. So I prefer to get into the job before doing the MC2. Do you suggest to look for jobs from websites, companies, or walking? Okay, that's a very important question. So you can only find the job from the websites and campaigns. Like their campaigns means when the healthcare services put their advertisement for a certain period of time, like Queensland, New South Wales do the campaigns, and Melbourne, like Victoria has AMCV. But outside the campaign, there are jobs available all over the year. So you can apply the jobs from the websites like seek.com, Indeed. I'll probably write Seek, Indeed. There are Australian websites for job. LinkedIn is a very good, very good source as well. So you can search Seek and Indeed as a resident medical officer or hospital medical officer, and then you will find the jobs there. You have to apply for those jobs through the healthcare service or hospital website, but you can find the jobs in Seek and Indeed. So if you found a job in Seek or Indeed, if you press the apply button, it will automatically take you to the healthcare service website or the hospital website, and you have to apply from there. And for the AMC part 1, like after the AMC part 1, IMG doctors, you have to apply by yourself. You can't apply through any agency or anyone. You have to apply by yourself. After getting the registration, you can apply through the agencies, but before that, you can't apply through the agencies. But I lost the question. Okay, and walk-in. So I will highly suggest, after applying the job, there is a contact email in every job advertisement. Or if you search on the hospital website, you will find a medical workforce contact email or contact number. After applying every job, try to send them an email. Like if you can go walking, if you are living in Australia, it's a best thing you can do. Just go walk in and talk to the medical workforce. I haven't done that, but I know people, they presented themselves to the medical workforce, requested them, like handed over their CV to the medical workforce team members, and they were called for the interview. But there are thousands of hospitals, and if you are applying for all over the Australia, it's not quite practical to walk in every time. But the hospitals that nearer to you, you can definitely give it a try, like walk in, just introduce yourself nicely, confidently, and just provide your CV to them, request them if there is any opportunities available, you are interested, show your interest, show your dedication. And you can collect their number as well, medical workforce number, keep calling them, keep chasing them. So like, don't hesitate that if I disturb them, they will not call me for the interview. The other side error. If you call them repeatedly, they will understand that you are really interested, you are dedicated. So if you're living in Australia, that are the positive things, like living here, being here, that you can go talk phone anytime to the medical workforce team. Yeah, try in every possible way, like for different people, different things clicked. Some people apply. I know one person, one of my friends, Simra, she's from Pakistan. She did apply for 900 jobs before getting the interview call. And some people just applied for 10 jobs and was shortlisted for 3 jobs. So no comparison, because everyone's journeys are very individual and very exceptional, you know. So try every possible way. That's my opinion. Like, different people will advise and suggest different things. It's your journey, it's your reality. It's a big commitment. MC1, it's a long journey, and at our age we have other commitments as well. We have family, we have our children, spouses, we have different commitments. So choose your battle wisely, and what you can do, try every possible way. What kind of CBT helps? Every kind of CBT. If it's medical related, every kind of CBT. Even if you do a CBD like communication skill, you know, like how to write documents, that will help as well. Any kind of CBT is, if it's medical related, if it's your role related, do as much of CBT as possible. Like, if you have the practice gap. The CBT points mandatory even if there is recency of practice? No. Until you get the job, it's not mandatory. If you have recency of practice, that will do. But not the CBT points are mandatory, but you have to show that you are committed for your career, to your career development. Like, you are doing job and you are doing nothing else, probably will not add any value to your CV. But if you show that you are doing BLS, ALS, workshop, courses, that will definitely add extra value to your CV. Like, if you think yourself, like, there are 2 candidates, one is working in a hospital, not doing any professional development courses, and another CV doing a hospital job and also keep doing the CBD courses, workshops. Which one will you prefer? So ask yourself. Definitely you will prefer someone who is showing the more commitment to the career development, to knowledge enhancement. So not necessarily you have to do the CPD points if you have the recency of practice, but show every kind of commitments for your professional development. May I ask, how can we apply for observership, please? So you can contact the hospitals individually. You can talk to the medical workforce and request them that you want to do a observership if they have the opportunities. Send them your CV and request them to give you an opportunity for observership. The hospital who does have the observership programs like Northern, Monash, there are other hospitals as well, forgot the name, but Northern, Monash, they have specific observership programs. They advertise on the website, on their website, or like Seek, Indeed, they advertise. And during that time, you have to apply for the observership. What, paying few thousand for job seeking website? No, not at all. So if you have LinkedIn, you can search on LinkedIn. Otherwise, Seek and Indeed is free. So, and Seek and Indeed is the major job searching websites in Australia. So I would say, like, pay your few thousands on your CPD courses, like do a ALS course, you know, do other resuscitation courses, do cannulation course. If you are in Australia, like, do the other courses with that money rather than spending on job seeking websites. What about recruitment agencies? If you don't have the registration yet, after registration, recruitment agencies can't do anything. So the hospital specifically mentions in their advertisement that if you are applying for the first time, or if you are a IMG, you have to apply by yourself. So no recruitment agency can help if you don't have the current AFRA registration. How to get residency in medicine department? Medical journey. Doctor, how to get residency in medicine department? Are you currently in Australia or out of Australia? If you can answer me that, then I can give you quite a straightforward answer. All right. So if you are in your country outside the Australia, just start working in your medicine department. Just try to find something, find a role in your country hospital, and that will be like accepted as a research or practice in medicine department. Basically, can't get disheartened. Yes, can't get disheartened. No way that you are in AMC journey and you will be disheartened. No way. You have to be strong. You have to be very optimistic, and you have to be very hardworking as well. Thank you, Dr. for your confidence with the valuable words. Observership need MC1, doctor. Yes, observership need MC1. Out of Australia, do I need research in some topics to get residency? Residency. Okay, sorry, residency in medicine. Sorry, I read as a residency in medicine. Residency in medicine. What do you mean by residency in medicine? You mean a training program in your country or job, residency job, like, oh, postgraduate education? I think the people who are currently living in outside Australia, like Nepal, Bangladesh, India, they'll be able to better answer this question. Because every different education system, healthcare education system, has different requirement. Like in Bangladesh, if anyone wants to do the FCPS in medicine, they have to pass FCPS 1, FCPS 2. So I'm not sure which country you are living and what's your system.
Doctor, I think she wants to know what about how to get into postgraduate education in Australia. I think that was her question.
Okay. So I'm asking you, as USMLE provides residency postgraduate living in Nepal. It's a bit different from Australia. So for residency program, like informal training program for that specialization, like medicine, surgery, psychiatry, whatever the specialization you want to be in, formal training program, you have to get your general registration. You have to show some prior experience on that specific field, and then you have to apply to that specialization authority board to get you in. What do you suggest, Doc? Doing MC1 then job, or doing MC2 right away? Okay. Maybe okay. So MC1 and MC1 and job, or MC2? If you ask me, if you are living in Nepal, I'm assuming you're living in Nepal or India or Bangladesh, I will highly suggest to keep applying. If you get the job, it's a big thing, and as you are living in your country, you are working, you have residency or practice, there are high chances that you will get interview calls. If you get the job, Why I'm saying that? Because AMC2 is very expensive. From a practical, if you think practically, it's a very expensive exam. So I prefer to get the job before doing AMC2. It definitely depends on you. What's your preference? What's your living situation, current situation? Some people prefers getting the job first. Some people prefers to study because it will keep your continuity of study. Like my reading partner from AMC1, she did the AMC2. She started preparing for AMC2. The next month, she passed AMC1. And I started looking for a job the next month. So it depends on your preference. There is no yes or no answer. And no one should decide for you as well. It's you. You have to think your reality. And yeah, you have to decide.
Doctor, there is one more question.
Yeah.
I graduated in 2023 on June. So after that, I'm practicing here in a cardiac center, and I have got 1 year experience here. So, like for getting a job after AMC1, just 1 year of job experience overseas is sufficient, or like I need around 2 years or more than 2 years, like which is suitable for getting job, doctor?
Just give me a moment. My laptop is showing low battery. I'll just connect the charger. We'll come back. Is it all right?
Yeah, that's all right, doctor.
Thank you.
And I think, Dr. Ashrita, this question has been answered like prior to the session as well. Like when she started, like it depends on the job you're applying. Like some needs like 1 year of experience, and some requires like 2 years of experience as well. So it depends on what they need. So it keeps on changing. So either your 1 year of experience will be like in the eligibility criteria as well, or they may ask for more than 1 year, 2 years. It depends on that. I think Dr. Fatima has already answered this before.
Yeah, doctor. I think she also mentioned, if I'm not mistaken, that for APRA, the minimum requirement is minimum 3 months of practice in last 12 months. Right, doctor?
Yeah, that's correct.
Okay.
That's correct.
So that's what APRA needs,
Yeah.
basically.
So if someone, for your better understanding, if someone has a practice gap for 12 months and living in Australia or Nepal or somewhere, they should get a recency of practice, like work experience, for at least 3 months. There are a few other things. It's quite complicated, but yeah, like 3 months is a pretty good time in last 1 year to show the recency of practice.
Doctor, I have the question like as you are addressing all the questions like about the job, about the other things after the MC part one. So like what sort of job like we need to look or apply for, like about the hunt, like in which position like we need to look for after the MC part one.
Okay. So before this year, the intern positions were not open for the IMGs. So they were only getting the interns from intern position for their local graduates. But from this year, I came to know that my hospital got 4 or 5 IMG interns. So starting from intern position, they count intern as a post-graduation year 1. So you can apply for intern position, hospital medical officer position, that HMO position, or RMO position, resident medical officer. Intern HMO, RMO. If in any specific field, if you have long experience like psychiatry, cardiology, emergency medicine, internal medicine, you can apply for unaccredited register position. So you will not be able to apply for accredited registers, but unaccredited register position. And also, if you have a pretty like heaps of experience in certain department, you can apply for senior resident medical officer, SRMO position as well. So depends on your experience. If you are freshly graduated, you have done your intern, just finish your intern, you can apply for intern position or RMO position. If you have few years of experiences, you can apply for, like still you can apply intern position because it will open the door for you. It will get you in the Australian medical system. So these are the positions: intern, HMO, RMO, SRMO, unaccredited register.
Thank you, Doctor. I think Dr.
Okay, so the
Darsin Rastala. Okay, so
last question, sorry, the New Zealand one. So if you pass your NZX exam, if you are registered doctor, like equivalent to our general registration, you know, like unconditional registration, general registration from New Zealand, you can apply the competent pathway. So there are few countries, their registration is accepted to Australia, like UK, Ireland, Denmark, New Zealand, USA. So if you are already get your registration from New Zealand, which is equivalent to our general registration, you can apply through the competent pathway. And the competent pathway is totally different thing. It's different from the standard pathway. What I was talking about today was mostly the standard pathway thing. So you can Google the AFRA competent pathway and their requirement. If you have already passed the AMC1, I would probably suggest you to think twice to go through another pathway. If you have already passed AMC1, do your recency, do your English test, and keep applying. It's a high chance for getting job. Or if you want to come through that way, like getting the New Zealand registration, then you can come through the competent pathway. Okay. Unaccredited position. I think I already explained that, the unaccredited position. So it's a kind of specialized position. You are working as a registrar, but you are not in formal training. So for being in the formal training, you have to get your general registration. Sometimes people who has the general registration still can work as an unaccredited registrar prior to get into the accredited position. So that's unaccredited positions.
Dr. Fatema, we got like Darsin Rastala who wanna ask a question, so I want to ask. Yeah.
Okay, thank you, Dr. Brajar. Good afternoon, Doctor. My question is regarding like after postgraduate, if someone wants to apply in medical officers or HMO, RMO jobs, because in his CV there will be gap. Like while he or she was studying, then there will be gap for 3 or 4 years. Then again, like currently, like I'm talking about mine. Okay, like there is gap while I studied. Then it's showing gap in my CV. Then currently I'm working as a general surgeon. then in that case, like if there is job vacancies for RMO in pediatrics or obs gynae or anything else, so what will be like pros and cons? What will be the chances of getting job? So it's better not to apply, or I should only look for surgical jobs.
So, sorry, for my better understanding, are you currently working as a general surgeon?
I'm currently I'm working as a general surgeon.
So, okay, so you have already completed your post-graduation program.
Yes.
Okay. You can definitely look for the jobs in your field because you have already finished your post-graduation and you are currently working as a general surgeon. When someone is working currently, that means he has the recency of practice, or like currently working, it doesn't matter how much gap was in his or her CV. Doesn't matter if you have any job, like if you have any gap or not. It doesn't matter for the hospitals, You can write 2 words in your CV that I was preparing for. I prefer to take keep myself away from working and prepare myself for the exam. So for that gap period, you can write 1 or 2 sentences that what was the reason for taking that gap. Try to mention something related to your clinical field, like I was preparing for my post-graduation or I was doing my post-graduation. It doesn't matter for the hospital if you are currently working.
So even I can apply for another jobs also, yeah? Like in pediatrics.
You can apply. You can apply. You still can apply. If you are a general surgeon, you can apply for any other departments as well. Few departments like psychiatry, it's very very specialized one. Like they prefer to have some psychiatric experiences in the CV. But as you are working as a general surgeon, you can say, like in my general surgeon position, I also deal with the pediatric patients as well. If you get the pediatrics patient, you can. All you have to you have to be very showing off kind of person. You have to extract all the good things from your current situation. So it's all about how you are expressing yourself, how you are selling yourself to them. So always try to extract few things, positive things from that negative situation. So you still can apply. Focus on what you are doing, your current role, and why you are a strong. You are doing a general surgery thing, but what makes you a strong candidate for pediatrics? So you have to be very tricky. If you don't have experiences in certain department, like obs and gynae, I'm doing psychiatry. Definitely, it won't be logical if I apply for obs and gynae without having any obs and gynae experiences. And when they are shortlisting, they actually get the sense that you are applying thoroughly just to get the job. You don't have long-term goal probably for this certain department. They got that sense somehow. So you have to be very tricky in that situation. If you are specialized in certain field and you are applying for different field, but still achievable, and it's nothing wrong applying.
Yeah, thank you, sir.
Thank you, Dr. Sudarshan, for your queries. I think it's been a really long session, and Dr. Fatima has been speaking for a long time. I think she might be too tired. And thank you, Doctor.
Thank you so much. From all the question, I got a sense that you probably don't know about the GP pathway.
Mhm.
GP means
PES,
general
yeah,
practice pathway, PESCI
yeah,
pathway,
yeah.
or probably not interested in. But that's a long discussion as well. If you think that many people are interested to know about that pathway, let me know.
Mhm.
I will
Maybe,
try to, yeah,
yeah, sure.
another
Maybe
session probably.
we can do the end of the session as well regarding the pesky pathway. So thank you, doctor, for your time, like your work, your household chores, and your kids, all those busy schedule. You make a time for us and gave a wonderful presentation, cleared a lot of queries that were inside many of doctors like aspirants as well.
No,
So
it was my absolute pleasure. I hope that was helpful. Um, I will send a simple CV to Pradjal, so he can send to everyone. I hope that will be helpful. But if I like,
yeah,
I'm very
sure.
forgetful. I'm very forgetful. I'll keep that in mind to send you the CV. Otherwise, you can just Google the AFRA CV format. So that's acceptable for every hospital in Australia. It's called AFRA CV. So try to make your CV in a proper format. If you like, if you want to make your CV through AFRA format, otherwise Queensland has their own format as well. So it's a bit different from our subcontinent CV, like Bangladesh. I'm not sure about Nepal, but I found like it was a bit different format from my country. So always try to search what are the formats are acceptable in Australia and try to make your CV according to that. I will send you a sample CV, Virtual.
Yeah, sure, sure. I'll share with all those doctors in the group. Uh, Thank you for your time, I would like to say. And all the doctors, like if you have any queries and those things, then we have WhatsApp group and we have the Facebook page as well. So if you have any queries, we can ask over there. And it's all free, of course. We have made available all the material, so everybody will like be able to access all the things and get to know more about the AMC pathway. So that's the thing. So thank you, Dr. Fatima, once again. So
Thank you
maybe,
everyone for joining and
yeah,
for participating in that long discussion. Um, I went very spontaneously. I made a slideshow, but I couldn't share my screen. But thank you everyone for joining. And if you have any question, leave Prozol your question, and I'm happy to answer.
yeah, sure. Maybe next time we'll do the next session as well, and
Yeah.
we'll clear out more issues. All right. Thank you, doctor, and
No
thank you
worries.
all for
Bye everyone. Have a
coming
very
to
good
the.
day.
Thank you.
Yeah. Bye.
Bye.
My doctor.
Thank you, Dr. Hello, Dr. Pargal. Can you hear me?
Hello. Yeah, I can hear you, doctor.
Thank you, Dr. Proswell. Everyone, if you have any queries, instead of sending us personal, I'm Dr. Dipendra. Okay, I think you all know me, and